Chris Cheek joins us now. I think he's a guy that's very smart. He's CEO of SentryCare. He has been involved in a number of businesses as a founder or co-founder, almost all of them related to the healthcare industry. And if you have been paying attention, you know that there is a very real conversation about insurance, health insurance in particular, and the rising costs related with it. Significant increases that are coming with healthcare premiums. Some of that conversation is tied to what's happening in Washington, D.C. right now with the government shutdown and ACA subsidies. But also you have Medicare and Medicaid and Medicare Advantage, which is something that is kind of stuck in the middle of all of this that hopefully we can get a little clarity on this morning. Chris, good morning to you.
Hey, good morning, Richard. Thanks for having me. I appreciate it.
I appreciate your time this morning. Let's start at the most basic level. People are familiar with Medicare, generally speaking. I think most people are fairly familiar with Medicaid, although sometimes those two things get conflated. But within Medicare, you have Part A, Part B, Part D, which is the prescription piece of this. And then there's kind of Part C, which, as I understand it, that's the Medicare Advantage piece. What is Medicare Advantage?
So Medicare Advantage is, you're correct, it's Part C. It is a Medicare replacement plan. So when you purchase a Medicare Advantage plan, you actually give up your traditional Medicare, and it is replaced by the for-profit company as a Medicare replacement plan. So you actually lose that traditional Medicare benefit. In addition to that, and I'm probably telling you more what it's not than what it is. In addition to that, it's also not a supplement. A lot of people come to us thinking that that they have this Medicare Advantage plan that adds on to their Medicare, but in the form of a supplement, and that they still have Medicare. But you actually do not have Medicare when you purchase a Medicare Advantage plan. You have a Part C Medicare replacement plan, as you have noted.
So Medicare Advantage is an alternative that some who are eligible for Medicare have chosen to use or have as their insurance instead of traditional Medicare?
That's correct, yes.
Okay. So as I understand it, there's been a significant growth in Medicare Advantage plans. It's something that has been marketed very aggressively by big insurance companies, private insurance companies over an extended period of time. And at least for a while, this seemed to make sense for a lot of people and is something that a lot of people have. I think I read that maybe for 15 years in a row, they've seen year over year growth in the number of these plans that have been purchased. But something has changed. What is that something?
Well, to tell you the truth, I think a lot of it is transparency. The Wall Street Journal did a great job in exposing what these plans really are. They are a form of profiteering on behalf of insurance companies that are basically rationing your health care back to you. And you're giving up all kind of rights when you buy one of these plans. They sound good. You get some trinkets with them. People kind of fall for those trinkets and say, wow, this is nice. I get this gym membership and all this kind of thing. But when you get really sick and really need full health care, it's a different story. There's all kinds of problems getting the coverage you need. There's prior authorizations. And if you talk to any healthcare provider, they will advise you against Medicare Advantage for those reasons. It's hard to deal with, and we're faced with it all the time. And in our nursing homes, in our hospital, we have people coming to us that would really like to have coverage to be able to be admitted, but they can't because they have this product. So it's a challenge.
I feel like when you get into to an industry that has what seems to be an infinite amount of acronyms, it feels like they're trying to hide something. You got PPOs and HMOs, and one of the things that I read about that seems to be unappealing to Medicare Advantage plans is the ability to choose your provider, your preferred provider or PPO. Is that accurate that these Advantage plans have made it harder for people to go to the doctors that they've always gone to, or go to the nursing homes or hospitals or specialty care facilities that they want to use?
Yes, that is correct. In fact, not all doctors take Medicare Advantage. To put a fine line on it, the Mayo Clinic doesn't take any Medicare Advantage. MD Anderson takes limited Medicare Advantage, and Vanderbilt takes limited Medicare Advantage. And the list goes on. So there's 20% of the healthcare facilities in the U.S. don't take Medicare Advantage, and that's hospitals, systems, and that's growing. So that is a huge problem. And the ones that do sort of do so reluctantly, if you will. So it is a big problem. Absolutely.
All right. So what is the advantage to Medicare Advantage, if you'll pardon the usage there? Because again, these are popular. They have been heavily marketed by insurance companies and in a lot of cases pushed. I understand from the perspective of insurance companies, it's an opportunity for them to sell their product and make their money. What's the advantage for patients outside of what you mentioned a second ago? You get a gym membership, or you get a reduced rate on some medicine along the way.
Yeah, well, it's cheaper from what I've been told. Now, I'm not an agent. Okay. I'm a healthcare executive. So I've been in the business since 1990 of taking care of people, and but it is some cheaper. But why people fall for that cheaper product is kind of beyond me. In the hospital business, I tell people, look, we're here to save your life and make your life better, but we're not here to save you a little bit of money. That's just not our job. But we need to be here for the community and for the community to thrive and be successful. So it's very frustrating from our standpoint when people get, hung up on the trinkets, the lower price, and there's even some scenarios where if you have a certain condition, that they will even pay you to join Medicare Advantage, which is sort of beyond me. I don't know that I understand how that's perfectly legal, but anyway, our tax dollars is going to pay people so that they can buy the plan. It's a little bit convoluted to me. I don't quite understand that part yet, but anyway, maybe I will one day.
All right. So what about costs of Medicare? You mentioned that Medicare Advantage in some scenarios seems to be less expensive than traditional Medicare. And there is, and by the way, we'll carry this conversation. We got a break coming up in about a minute. Okay. I do think there's a misconception with Medicare. For some people, they're like, hey, I worked my entire life and I've been, paying into Social Security and I've got money that's going to Medicare. And when I retire, hey, my insurance is going to be free. And that is simply not the case, whether it's with Medicare or Medicare Advantage. That's accurate, right?
That's accurate. Yes, that's right.
And,
yes.
and Medicaid is the program that is more for low-income individuals and those who can't afford Medicare. All right.
That's right.
We'll pick this conversation up on the other side. I want to tell you about a website that Chris and his companies have developed, keepyourmedicare.com. It answers some of the questions about Medicare Advantage, shows some of the detriments that exist. We'll talk about what people need to be doing as we have made it into open enrollment. What's the answer for you going forward? Chris Cheek, CEO at SentryCare, is my guest. It's Mornings with Richard Cross on SuperTalk, Mississippi. Glad to be with you on this Tuesday morning, the 21st of October. It is Mornings with Richard Cross on SuperTalk, Mississippi. Chris Cheek is my guest. He is the CEO at SentryCare, has worked in the healthcare industry since, as he said earlier, around 1990. And we're talking about rising insurance premiums, rising costs in the healthcare industry, and Medicare Advantage plans, and the things that you need to be aware of when you are looking at insurance. A couple of things that we didn't mention. We were kind of talking about different terms, Medicare A, Medicare B, Medicare D. Medigap, which is this gap insurance that is available for people to purchase when they retire. Chris, some people simply either don't have a need for it initially after retirement, or they think they don't want to or can't afford to spend the additional money on Medigap coverage. I've heard and have been told that it becomes more difficult to get and more expensive to get if you don't get that as soon as you were first eligible for it. What is the role of Medigap?
So Medigap is really important. So what we tell people instead of a Medicare Advantage plan is we tell them focus on the 3 M's. The first M is Medicare, which is Medicare.gov, and that's your Part A and your Part B. The second one is your Medigap policy. The second M is Medigap. It's also called a supplement. You have a 6-month window, more or less. Once you pay for Part B, you have a 6-month window where you can get a Medigap policy or supplement. And you're guaranteed to get that policy. You pick the one you want, and if you do it inside that window, you're guaranteed issue without any underwriting concerns for healthcare. So you're covered. You got it. And the third M we tell people is their medications. That's their Part D plan. I know you didn't ask about that, but I'm just trying to present this acronym to help people out. So it's Medicare, Medigap supplement, and then your medications with your Part D plan. It's important to note relative to this Medigap policy, though, that if you go the Medicare Advantage route and you decide, I want to go back to traditional Medicare, and you have become ill and not getting the services that you want, you will likely give up your opportunity to get a supplement or a Medigap policy because you have become uninsurable and it will likely be too expensive for you. So one thing you got to realize is that once you get Medicare Advantage, you may lose that opportunity to get that Medigap policy that you just referenced if you're outside that guarantee issue window. So it's something to really understand and know about and make sure that you're making the right decision.
Is the cost of Medigap guaranteed, or can that change year to year as you go through open enrollment each year? Once you have initially obtained that Medigap policy?
Once you've obtained that policy, that cost is going to, I don't think it's stagnant, but it's not like if you get it later, it's going to be more expensive. But if you get it on time, if you will, in that 6-month window, it's going to be much more affordable. So again, I don't know that exact cost, but.
Yeah, I mean, I guess what I was getting at is, let's say I'm 68 years old and I retire and I go into Medicare. Mm-hmm. I don't know exactly what the age number is where you transition to Medicare. And I get that Medigap initially, and let's say it costs me, I don't know, $75 a month for Medigap coverage. Mm-hmm. 3 years from now, when I'm 71, is that $75 Medigap going to now cost me $125 or $200? But you're saying don't know exactly how that works?
I don't know exactly what that number is, but what I am saying is that if you wait to get that and you think you're going to go back and get it at a later time outside that guarantee issue window, that's when it gets terribly expensive.
Okay. What about people that are changing? So I mentioned open enrollment. That is going on right now. I think started last week. And if you are in Medicare, do you have the ability to leave Medicare to go get a Medicare Advantage plan? If you're in a Medicare Advantage plan, can you leave that program and go to Medicare or back to Medicare in some cases?
Yeah. You could leave Medicare and go to Medicare Advantage. I'm not sure why you'd want to do that, given what's on our website and what you can see in the news every day. But coming back the other way is difficult. You probably will have trouble getting a supplement. So you'd have to be careful with that.
And the supplement is the biggest thing, right? You talked about the importance of that supplement because that's the part of the policy that covers big expenses. Is that the best way to describe that?
No, actually, it's actually the Medicare Part A covers the big expenses. The supplement wraps around your Part A, covers the copays and deductibles. And listen, I know people who have had horrible cancer episodes and had a traditional Medicare with a supplement, zero bills. Won't happen with Medicare Advantage. Won't happen.
Okay.
All kind of copays and things that pop up. So
what are the questions?
Very important to understand that.
Yeah. What are the questions that people need to be asking, whether it's a benefits manager or, if they're getting ready to retire and maybe work for the state or for a university? Mm-hmm. or a hospital system, and there's somebody usually that can kind of help you with all of the options that you're going to have to, all the choices that you're going to have to make as you transition into retirement. What are the questions that people need to ask?
I think the one thing that we have in our healthcare system that's problematic is this whole thing is full of conflicts of interest. So you've got to wade through who are you talking to that's conflicted in what they're telling you. So you have to keep that in the back of your mind. But we have to rely on agents to help us with to get a supplement and a deep. If you want to go down the road of a Medicare Advantage plan and take a look at that, they sell those as well. So they handle a lot of those issues, a lot of those questions. But the first thing I want to know, first thing I'm going to do, and my wife will start this process next month, and the first thing she's going to do is look at a supplement policy and a Part D plan, and you go to an agent to get those done. But that's the first thing to work out, in my opinion, is getting those two things taken care of. Does that help answer your question?
Yeah, no, absolutely. I mean, it's just like it feels like people need to be educated.
Yes.
You don't know what you don't know sometimes,
right?
And you don't even know exactly the right questions that you need to be asking. Again, the website is keepyourmedicare.com. There's a lot of helpful information that kind of gives you the tools to make the decision that's best for you. Yeah. This conversation Richard, we got going on in Washington right now about ACA subsidies, government shutdown, cost of insurance going up. Does that have anything to do with what we're talking about now with Medicare, Medicare Advantage, or is that for younger people that aren't eligible at all for these programs?
Yeah, more the latter. It's for people that are on the marketplace. And look, it's important that we all have insurance. And so they need to work through that and try to, I'm just a big fan of everybody having insurance and doing your responsible thing. And I think we all have we should all work hard, and we should all provide our insurance and pay our property taxes and pay our taxes so we can all live, peaceful lives. Right. And so I hope they get through that, and let's work through that.
Let me ask you this question based on some of the questions that we've got. We've gotten a lot of messages on the C Spire text line that say, hey, Medicare Advantage is a sham. You don't want to go down this road. But there are also some people that have said, okay, why is Chris advocating for this? How does this benefit him? So I'll just simply ask you that
Good question.
Why is it that you are advocating for people, hey, stick with Medicare, don't go down this road of Medicare Advantage?
It's real simple. I'm a healthcare provider, and that's all I've done in my career is providing healthcare to people. And I've seen people in our nursing homes and in our hospital crying because they thought they had Medicare, and all they had was a Medicare Advantage plan and an old Medicare card. And I've just seen enough people crying and begging for us to take them because their Medicare Advantage company said, no, we're not providing. And I just checked on somebody a little while ago that they were an elderly man. He needed a skilled stay after a hospitalization, and that his Medicare Advantage company turned him down. And my good friend, who's a doctor, tried to admit a lady to our hospital the other day with pneumonia. This guy's a 40-year internist. Tried to admit her to the hospital, and the Medicare Advantage plan said, we think she needs to go home with oral antibiotics. You know what? She went home with oral antibiotics and died 2 days later. So I've just heard all of it I can take. And I don't make a nickel off of this website. I don't make a nickel doing what I'm doing now. I'm not a broker. I'm not doing this commission. I'm strictly doing this to try to tell the world, be careful. This is a huge problem. It is the biggest financial threat to our healthcare system is Medicare Advantage. The biggest financial threat to our healthcare system. And I'm not the only one saying that. Just look at the Wall Street Journal. They printed it all over there.
There is, if you are a subscriber to the Wall Street Journal, a really good story that came out, I think it was just last week, that really identifies some of the issues with Medicare Advantage and spells it out pretty clearly. Chris, thanks so much for your time this morning, for shedding some light on this issue, and maybe we can talk again down the line.
I'd look forward to it. Thanks, and it's a privilege meeting you. I appreciate it very much. You have a wonderful day.
You as well. Chris Cheek, he's CEO at SentryCare. He's been in the medical field for a long time, and hopefully that shines some light on this issue that is affecting hundreds of thousands, if not millions of Americans, seniors who are sometimes vulnerable health-wise.